So welcome everyone. I'm Tony Monaco, president of the university, and thank you all for joining us this afternoon to celebrate the establishment of the Gerald R. Gill Professorship of Race, Culture, and Society and the appointment of Madina Agénor as the inaugural Gerald R. Gill Assistant Professor of Race, Culture, and Society. Gifts to support professorships allow us the flexibility to attract and retain the most talented faculty, who in turn inspire generations of students. Current students share with me the impact that faculty have on their career choices, life plans, and values. Alumni who I meet on campus and around the world share warm memories of their favorite faculty. Mentors whose impact has lasted long after graduation. Teachers who have changed their lives. And faculty research and scholarship have the ability to change the world for the better, and our faculty truly are the bedrock on which our university is built. It is fitting that this professorship is named after one of Tufts' most beloved and admired faculty members. Dr. Gerald R. Gill was an inspiration to generations of Tufts students, as well as to his colleagues and friends. This is evidenced by the fact that more than 350 individual donors contributed to this professorship. And I'm grateful to all of them for their support of this, and thank you for doing that. Dr. Gill pushed Tufts to a better place, a more inclusive place, one that is welcoming to all. His research and teaching garnered him many honors from the academic community at Tufts and beyond. On campus, he won the first Lehrman-Neubauer Prize for outstanding teaching and advising. He was twice named the Massachusetts Professor of the Year by the Carnegie Foundation for the Advancement of Teaching. He was a founding and core faculty member of pioneering interdisciplinary programs, American Studies, Africa in the New World Studies, and Peace and Justice Studies. His courses in African American history, the Civil Rights Movement, and sports in American history were always filled to capacity. The breadth of his knowledge, the creativity of his assignments, and his capacity to make the past come alive inspired generations of students at Tufts. His contributions were varied and his legacy has been profound. I am grateful that today two of his former colleagues will share their personal reflection on Dr. Gill's life, his influence on the Tufts campus, and the inspiration he offered to so many alumni and friends of Tufts University. It is my pleasure to welcome Jean Penven, Professor of History Emerita, to give her remarks, and after Jean speaks, we'll hear from Pearl Robinson, Associate Professor of Political Science. Thank you very much and enjoy the day.
Thank you, President Monaco. Good afternoon. I am grateful for the opportunity to celebrate the Gerald R. Gill Chair in Race, Culture, and Society and to welcome its inaugural holder, Professor Madina Agénor. Welcome. Never doubt that Gerald Gill's spirit will sustain you and your work. It is always around here. It kicks in with special vigor whenever we need it. Professor Gill's generosity and his commitment to teaching, mentoring, social inquiry, and community engagement live on in many forms at Tufts and in the greater Boston area. You will pick up on Professor Gill's energy here, and his spirit and legacy are literally embodied in generations of Tufts graduates who have spread out from this hill, as Professor Monaco suggested. Gerald Gill took great pride in his many hundreds of students. No matter their GPA, no matter their major, he taught across the curriculum, and students from any and every major flocked to his classrooms. Gerald Gill's students went on to build careers in many fields around the country and the world. And thanks to their time with him, each had a firmer grounding regarding race, culture, and society. And I am sure that to this day, they carry his spirit, and I know that his spirit glows with pride for each one of them. Professor Gill was an historian, a teacher scholar, and a citizen committed to greater equality. Today, I can only highlight a few of his students, and so I am shamelessly featuring historians. Sorry. I'm highlighting alums whose work confirms the power of the remembered past to shape the imagined future. Nothing is more important than the role of the past in our capacity to shape an imagined future. Professor Gill inspired all of his students to pursue equity, opportunity, and justice through history and historical education, and also medicine and law and community health. Behind me, you see small snapshots of students whose work and growing footprints in our world always made Gerald Gill glow. He recognized their potential from the outset. Seth Markle, now at Trinity, writes on Black power and Pan-Africanism. Adam Goodman, behind me and in front of me, now at the University of Illinois, Chicago, writes on Latin American immigration in the US and our deportation machine. Max Felker-Cantor at Ball State University confronted policing in Los Angeles. And Zachariah Mompili at Vassar College refused to ignore the capacity of African insurgents to rule in ways that scholars had not yet considered. His work on insurgency and governance in Africa has changed our paradigms. Zachariah and Seth and many of Gerald Gill's students also worked with Professor Pearl Robinson. These alums are now work in elite institutions, but many hundreds more, like Carolyn Burrs and Benji Cohen and Eric Chapman, work in the very challenging trenches of our nation's public schools. In their classrooms, they view issues of social justice in historical perspective. Professor Gill's lifelong activism was as gracious as it was unwavering. And in that image, Emery Wright, founder of and co-director of Project South in Atlanta, organizes for social change and community empowerment across this country. Project South's work for voter registration insisted, we will be heard. We will not be erased. Indeed, the Black radical tradition in the South will not be erased. And finally, documentary filmmaker Molly Blank probes the enduring inequality in education and the growing xenophobia in South Africa. The energy and grounding of her international work was sparked by Professor Gill and fueled by his teaching and mentoring. How wonderful to remember this man and the students that he has inspired. They all knew him well. They treasured all that he shared with him. His unstinting commitment to them, their education, marked them. Generations of his students carried his passion and energy from this hill into their lives and careers around the world. It matters. It endures. Thank you, Gerald Gill.
Sitting here, remembering when we celebrated in this room, Gerald Gill's winning the Massachusetts Professor of the Year twice. We also had a piano, and Guy Ramsey playing music, and there were lots of children. People brought their children as well. Another light on the hill. First of all, I'm curious. How many of you here have had occasion to read a copy of a newspaper published on the day you were born? How many of you were students of Professor Gill's? The birthday newspaper assignment was one of the foundational elements of Professor Gerald Gill's pedagogy. Students who enrolled in a course on African American history typically entered from the perspective of I and the other. I want to learn about what they have been doing. At the outset, Gill would send his students to the library to find out what was happening on the day that they were born. This exercise immediately inserted them into the history of their time. The assignment was an entry point for reading about what was going on in the country that day. Students might also glimpse at some of the paper's international coverage. Most importantly, they would look for stories about African Americans, people as well as issues. If there was nothing to be found, students were introduced to the phenomenon of historical erasure. If what they did find was largely negative or demeaning, they might begin to discern how negative stereotypes are disseminated. And we can imagine that at least a few students came across stories about the freedom struggles that were percolating across the land and that they would learn more about in Gerald Gill's courses. But whatever the case, the fruits of this exercise, when brought into Gill's classroom, enabled his students to share a personal connection with some of the generative processes that constituted the fabric of African American history. In this learning space, the many could become one. And after a few years, it became evident that students were spreading the word. You've got to take African American history with Gill. That course, in fact, would become one of the markers of a Tufts undergraduate education. Professor Gill's introductory African American history course attracted students from across the university, arts, sciences, and engineering, liberal to conservative political views, the full spectrum of sexuality, as well as some international students. And he had the gift of being able to remember not only the name of every student he ever taught, but also their intellectual interests and accomplishments, and for some, even their extracurricular hobbies, especially if it had something to do with baseball. He engaged with faculty colleagues from a wide range of disciplines and was knowledgeable about the research and scholarship of many. He also greeted, chatted with, and knew the names of many of the staff and service workers across the university. These and many other admirable attributes led to Gerald Gill being named Massachusetts Professor of the Year twice. Professor Gill's love for Tufts was centered in his students, current as well as alumni. And during his tenure at Tufts, the university's African American students came to form the centerpiece of his scholarship. Gerald Gill took it upon himself to memorialize not only the presence of Black students on the Hill, but more importantly, their contributions to the university's identity and its educational mission. To this end, he initiated two projects: a written history of the experiences of Black undergraduates at Tufts, which he referred to as Another Light on the Hill, and an historical markers project, which he called Tufts Black Freedom Trail. Professor Gill did extensive research on the Black presence at Tufts. He taught us that the struggle for educational opportunities has been one of the central topics in the history of the African American in the United States. His scholarship was designed to insert Blacks who studied at Tufts into that history. And he took pride in reminding us that the liberal humanism of the Universalist tradition upon which Tufts was founded held as a central premise the right to education for all. Gerald Gill's article, Another Light on the Hill, Black Undergraduates and Tufts, appeared in the spring 2000 issue of Tufts magazine. but he died before bringing the project to fruition. The extensive records produced by his research for this project are now in the Gerald Gill papers housed in Tufts University's digital collection and archives. And it's my distinct honor, privilege, and joy to be using some of those archives in a course that I'm teaching this semester on the Howard School of International Affairs. Professor Gill inaugurated his plan to create a Black Freedom Trail on Tufts Medford's campus on homecoming weekend in 2004. That Saturday, he joined a group of African American alumni in a tree planting ceremony at the top of the hill between Goddard Chapel and Ballou Hall. They also laid a memorial plaque to honor the long history and legacy of African-descended students at Tufts. A decade later, Professor Kendra Hill and Dr. Carrie Greenridge breathed new life into this initiative by launching the African American Trail Project. Gill's concept has now evolved into a citywide network of archives housed at Tufts University that maps African American and African descended public history sites across the greater Boston area and develops collaborative, community-based public history projects. It's a wonderful way of continuing his presence and legacy at Tufts and in the greater Boston area. We are gathered here today to celebrate the creation of the Gerald R. Gill Professorship in Race, Culture, Society, and I include human health, and to welcome the inaugural recipient of this chair, Professor Madina Agénor, who is in the Department of Community Health. In ways that may not be immediately obvious, she is especially well suited to be the first holder of the Gerald Gill Professorship. Professor Madina Agénor is a social epidemiologist and health services researcher. Her research focuses on health and healthcare inequalities in relation to various dimensions of social inequality, especially sexual orientation, gender identity, and race and ethnicity. Although we seldom talk about it, Gerald Gill went through life marked by what he and I used to sometimes joke about as the curse of the multiple Black people's diseases. For him, it was hypertension, diabetes, and heart problems. He was being treated for 2 or 3 of these problems at a time, and over the years, as the dosage of each medication increased, they began to interact in ways that were harmful. Some of his close friends noticed his declining health, and we tried, unsuccessfully, to offer a helping hand. We now know that fields such as community health and epidemiology should be treated as an integral part of the study of race, culture, and society. At Tufts, we are looking to Professor Madina Agénor to be one of the trailblazers. I extend a warm welcome to you, the Gerald R. Gill Professor of Race, Culture, Society, and Community Health, as our newest light on the hill.
Thank you, Dr. Penven and Dr. Robinson, for sharing that wonderful testimony to the legacy of Gerald Gill. It is now my great honor to introduce the inaugural holder of Gerald R. Gill Professorship in Race, Culture, and Society, Dr. Madina Agénor. In academe, the greatest recognition we can bestow upon such a beloved faculty member like Dr. Gill is to name a professorship for them in perpetuity. This fund is intended to honor Dr. Gill's memory and create a permanent legacy to his life, his scholarship, and his commitment and service to Tufts. This professorship is intended to support a professor who teaches about race, culture, and society and reflects the values that Professor Gill espoused and taught during his 25 years at Tufts University. We're thrilled to have Dr. Agénor here as the inaugural Gerald R. Gill Assistant Professor of Race, Culture, and Society, as her teaching and research truly exemplify the ideals that Dr. Gill exemplified in his lifetime. I remember vividly the excitement of Professor Jennifer Allen, Chair of Community Health, when she told me that Dr. Agénor had applied. We worked very hard to bring her here to be part of this wonderful department full of staff and faculty and students that's just exploding with energy and excitement and attracting lots of student interest. And I remember Jim Glazer's excitement when he had the idea of bestowing the chair upon Madina. So this has been a very wonderful path to be part of. Dr. Madina Agénor received her Bachelor of Arts in Community Health and Gender Studies from Brown University, her Master's in Public Health and Socio-Medical Sciences from Columbia University Mailman School of Public Health, and her Doctor of Science in Social and Behavioral Sciences from the Harvard T.H. Chan School of Public Health. She joined the Tufts faculty on September 1, 2019, and in just 6 months has already made an amazing start in her teaching and research and has been actively building bridges to many other departments and programs. As Pearl Robinson has sketched out, Dr. Agénor's research uses both quantitative and qualitative research methods to investigate health inequities related to race, ethnicity, sexual orientation, and gender identity. It spans topics ranging from cervical cancer screening to contraceptive care. Her current research focuses on the policy and provider determinants of sexual and reproductive health among women in the United States in relation to both ethnicity and race and sexual orientation. She's published in the American Journal of Public Health, the American Journal of Preventive Medicine, and the Annals of Internal Medicine, to name a few, and those are very prestigious places to be publishing. So please join me in welcoming Dr. Agénor.
Thank you.
Wow, thank you all so much. I'm supposed to speak after that, no big deal. Thank you for the really warm welcome today and at Tufts more generally. It's really been a pleasure to meet all of the colleagues here and staff and students. It's really been an amazing 6 months. So thank you so much for welcoming me into your community, which is now my community, so I appreciate it. And thank you, Jean and Pearl, for the amazing words that you just shared with us about Professor Gill. Unfortunately, I never had the chance to meet him, but through your stories, I'm able to get a sense of how incredible he was. So thank you so much for sharing those. They're incredibly powerful for me, and I'm sure everybody else in this room and elsewhere. Okay, so with that, let me get started with my presentation. So first of all, happy International Women's Day, everyone. Yes, very fitting that my presentation is on this day. And thank you again so much for being here. It's really a pleasure and an honor to be with all of you in this room to celebrate the life, legacy, and now new professorship of Dr. Gerald R. Gill. And today, as Pearl mentioned and others mentioned, I'll be talking about race, culture, society, and health, with a particular focus on maternal mortality among Black women in the United States. So from what I've gathered in my conversations with Professor Gill's former colleagues and students, he was an incredibly dynamic and engaging person, an out-of-this-world teacher who inspired all those around him, and an expert on and advocate of African-American history and racial justice at Tufts, in Boston, and the United States more generally. One of his former students with whom I spoke a little while ago described Professor Gill as a quote-unquote legend and called his African-American history class a rite of passage. So before I get started with my talk, I want to thank President Monaco, Deans Glazer, Honor, and Brusuela, and my department chair, Dr. Allen, for the incredible honor of being awarded the Gerald R. Gill Professorship of Race, Culture, and Society. It's really an honor that I'm very grateful for. And after learning more about Professor Gill and his incredible work and spirit, I'm really humbled by. I'm also incredibly inspired to follow in Professor Gill's footsteps to the extent that I can. I'm inspired to be the best teacher that I can be here at Tufts, and also to continue advancing racial justice in ways big and small through my work. So as Pearl and Joe noted, I was trained as a social epidemiologist, and I'm committed to investigating how social inequalities at multiple levels of society influence the health of marginalized populations, including Black women and girls and LGBTQ communities, and that's the perspective from which I'll be speaking today. So bringing together the professorship's themes of race, culture, and society, Professor Gill's discipline of history, and my own discipline of public health, I'll address how racism, which operates at all of the levels that you see here, shapes a critically important and pressing population health issue, maternal mortality among Black women in the United States. So some of you may remember that in 2002, the then Institute of Medicine released a landmark report that showed unequivocally that people of color, including Black, Latinx, and Native individuals, were more likely than their white counterparts to have poor health and healthcare outcomes in a whole host of areas. One of these areas, which you may have read in the news lately, is maternal mortality among Black women in the United States. The staggeringly high rate of pregnancy-related deaths among Black women from all socioeconomic backgrounds has rightly been called a quote-unquote crisis, and recently led the Harvard Public Health Review to conclude that, quote, America is failing its Black mothers. And this conclusion is by no means hyperbole. When you look at the data from the Centers for Disease Control and Prevention, you see that the maternal mortality rate was 47 per 100,000 live births among Black women, compared to 16 per 100,000 among white women in 2008 to 2009. And you can also see here that the Black maternal mortality rate increased to a high of 56 per 100,000 in 2013 to 2014. So based on these data, we see that Black women are 3 to 4 times more likely than white women to die from pregnancy-related causes, including hemorrhage, infection, and conditions related to cardiovascular disease and hypertension. But the question remains, why? Why do we see such high rates of maternal mortality among Black women in particular? And why should we care about identifying the drivers of these patterns? Well, we should all care about identifying the determinants of racial inequities in maternal mortality because they will determine what we do. Specifically, the explanations we give for these inequities will shape the types of laws, policies, programs, systems, and practices that we put into place to address them. And these actions will in turn determine what happens to the disproportionate burden of pregnancy-related deaths among Black women, namely whether it continues to rise as it has over the years or whether it finally starts to come down. In preparing for this talk today, I reviewed the surprisingly small scientific literature on racial inequities and maternal mortality among women in the United States, and found that medical and public health researchers generally offer two types of explanations for the considerably higher burden of pregnancy-related deaths among Black compared to white women. And these are biomedical factors and socioeconomic factors. So the biomedical factors that researchers generally point to in explaining racial inequities and maternal mortality include maternal age, live birth order, gestational age, unintended pregnancy, and prenatal care. Some researchers have also postulated that socioeconomic factors such as income, education, occupation are major drivers of these inequities. However, many have pointed out that attributing the disproportionate burden of pregnancy-related deaths among Black women to biomedical and behavioral factors blames women for their deaths, when in fact we know through decades and decades and decades of research that morbidity and mortality are shaped by a whole host of historically contingent social, economic, and political factors that are beyond an individual's control. And on top of that, several studies have shown that the explanations generally given by most researchers for racial inequities and maternal mortality, so differences in biomedical factors and socioeconomic factors between Black and white women, in fact, do not account for them in statistical models. So then the question becomes, if individual level medical and socioeconomic factors do not explain the disproportionately high burden of pregnancy-related deaths among Black women, well, what does? To answer that question, I turn to the social determinants of health conceptual framework, which suggests that we should look to the social and political, and I would also add historical, context in which racial inequities and maternal mortality occur. And one of the most pervasive and persistent aspects of the United States social and political context since its founding is racism, which Dr. David Williams, a leading social epidemiologist and scholar of racism and health, defines as a, quote, an organized system premised on the categorization and ranking of social groups into races that devalues, disempowers, and inequitably allocates desirable societal opportunities and resources to racialized groups regarded as inferior. Today, I'll be discussing how racism, which operates at the structural, cultural, and interpersonal levels, increase Black women's risk of dying from pregnancy-related causes through its effects before, during, and after pregnancy. But before I do that, it's important that we all get on the same page about what we're actually talking about. So I'll start with structural racism, which we defined in 2017, in our 2017 Lancet paper, as the, quote, totality of ways in which societies foster racial discrimination through mutually reinforcing systems of housing, education, employment, earnings, benefits, credit, media, healthcare, and criminal justice, including how these systems were first set up and to whose benefit and for what purpose, and how they continue to marginalize, devalue, exploit, and harm Black individuals and other people of color today. At the cultural level, racism takes on the form of stereotypes and depictions that vilify, mock, and dehumanize Black people and other people of color. Racist representations of Black men and women were generated during slavery and institutionalized through the minstrel shows of the 19th and early 20th centuries, during which white men painted their faces Black and caricatured Black men and women who they depicted as lazy, stupid, immoral, and hypersexual. These racist stereotypes continue to be developed and propagated through the 20th century through theater, film, radio, and television, including Birth of a Nation, Gone with the Wind, and Amos and Andy, which Black men and women actively protested. These and other representations peddled racist stereotypes and depictions of Black women in particular as hypersexual, malicious, overbearing, immoral, and unfit caretakers, among countless others, which continue to be spread through popular culture and media today. Interpersonal racism permeates all systems of US society, including the employment, housing, credit, and consumer markets, and the education, criminal, legal, and healthcare systems. For example, in a 2017 NPR Robert Wood Johnson Harvard University poll, at least half of Black Americans reported that they had been treated unfairly because they were Black in the areas of pay and promotion, hiring, and interaction with police. And about 30% of Black respondents reported that they had experienced interpersonal racism in a healthcare setting. In terms of the healthcare system in particular, Harriet Washington, Dorothy Roberts, and others have documented the long history of medical experimentation and exploitation of Black men and women by white physicians. And this includes in the field of gynecology, which to this day relies on surgical procedures developed by Marion Sims, pictured here, on enslaved Black women without using anesthesia. In recent years, interpersonal racism in the healthcare system has looked like the forced or coerced sterilization of Black women and girls, physicians and nurses providing Black patients with less pain medication than white patients, and healthcare providers not believing, ignoring, and dismissing the pregnancy-related symptoms and concerns of Black mothers. So now that we know how racism operates at multiple levels of society, the question is, how does it specifically affect Black women's risk of dying from pregnancy-related causes? Well, one way that structural, cultural, and interpersonal racism shapes Black maternal mortality is through what Arlene Geronimus calls weathering, or early health deterioration due to the physiological stress caused by racism across the life course, such that on average, younger Black women from both low and high socioeconomic backgrounds have the maternal mortality risk from conditions related to cardiovascular disease and hypertension of white women who are significantly older. Another way that racism affects Black maternal mortality is through the quality of the care provided before, during, and after labor and delivery. Specifically, as a result of structural racism, including but not limited to residential segregation, Black women are more likely than their white counterparts to receive pregnancy-related care at segregated hospitals with fewer resources. Also, as a result of cultural and interpersonal racism, Black women are more likely than white women to be treated poorly by healthcare providers and to receive delayed, suboptimal, or unwanted care, or to be denied needed health services altogether. So in light of all of this, what can we do to address the astonishingly high burden of Black maternal mortality in the United States? In recent months, you may have heard many proposals seeking to decrease the occurrence of and racial ethnic inequities in maternal mortality among US women, including things like establishing maternal mortality review committees. While encouraging, these efforts will not, in and of themselves, address the various ways through which structural, cultural, and interpersonal racism harm the health of Black mothers, as we've discussed today. Instead, Black women's health advocates, providers, and scholars have noted that tackling the high burden of pregnancy-related deaths among Black women will require a reproductive justice approach. Instead, a reproductive justice approach, yes. So reproductive justice, which you may have heard of, was coined by Black women in 1994 and refers to, quote, the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. This framework and strategy is unique in the sense that it centers the needs and lives of Black women and other women of color, analyzes the effect of systems of power, such as racism, addresses the intersection of multiple dimensions of social inequality, so sexism, racism, classism, homophobia, and brings together multiple social movements to address the underlying causes of reproductive injustices, which are framed as human rights violations. In thinking about the way forward, the Black Mamas Matter Alliance, which is a Black woman-led reproductive justice organization, points us in the right direction. They suggest that to effectively address the Black maternal mortality crisis in the United States, we must work on two fronts, the policy front and the healthcare delivery front. In terms of policy, state policies that establish programs and allocate resources to addressing racial inequities and maternal mortality are needed, as are federal and state policies that facilitate Black women's access to high-quality, affordable care that meets their needs across the life course. Additionally, social policies that address racism at multiple levels and facilitate Black women's meaningful participation as equal members in all sectors of society are also needed to promote Black maternal health. In terms of healthcare delivery, federal, state, and local investments are needed to make sure that hospitals located in predominantly Black neighborhoods where the majority of Black women give birth have the resources they need to provide Black women with high-quality care before, during, and after pregnancy. Also, all healthcare institutions should ensure that Black female providers are hired and retained, as this has shown to make a difference in other healthcare outcomes, and that pregnancy-related care, and really all care across the life course, is both accessible and affordable to Black women. Healthcare facilities should also train all providers to work in multidisciplinary teams and deliver patient-centered, structurally competent, and culturally responsive care that involves things like informed consent, shared decision-making, respectful patient-provider communication, as well as linkages to social services, social support, and birth professionals such as midwives and doulas to Black women and other marginalized patients. In all of these efforts, it is imperative that Black women, including researchers, providers, advocates, politicians, activists, and community members, be at the table to lead the charge to really save our lives. Here at Tufts, my colleagues in community health and at Tufts Medical Center have organized the now second annual Black Maternal Mortality Conference, which will be centering the voices and experiences of Black maternal health advocates and activists. So I hope that you will all join them there to continue this conversation. For now, however, I want to thank all of you for listening. And I also want to thank all of those who established the Gerald R. Gill Professorship for this opportunity. I also want to thank everyone who produced this event. I know it's a lot of work went into this, so thank you so much. And I also, last but certainly not least, want to thank all of the donors, big and small, who came together to continue Professor Gill's legacy, both here at Tufts and beyond. And I really do look forward to following in his footsteps. And thank you very much for this incredible honor. Questions? Comments, thoughts? Yes.
I was quite interested in your concept of weathering.
Yes.
And there's been a lot of interest in stress and particular traumatic events that cause effects not only in those individuals, but in generations to follow. And I wonder whether some of the weathering effect could have, I mean, there's a biological mechanism that is better understood now, whether the weathering effect will have transgenerational effects, which means that even if we improve many of the things, you might see that there's quite a delay in improvement. I just thought, curious to know your thoughts on that.
Yes, absolutely. That's an excellent question, and what makes this such a huge and pressing issue is precisely that the effects are transmitted biologically. So there's now 2 measures of weathering. There's allostatic load, which measures your stress hormones and also markers of chronic diseases. And there's also telomere length. Telomeres are kind of the tips of the DNA, and they're passed down over time. So yes, absolutely. This is what makes it so urgent, is that it will not only have effects, the effect of racism on health, on the current generation and folks who are alive today, but for future generations to come. Absolutely. Yes.
Hi, thank you so much for your talk. My name's Isabel. I'm a medical student and public health student across the river. And I loved your talk so much because there was a big focus on what we can do to make things better. And so I was wondering from your perspective if you could share, right here in our own backyards, the greater Boston area is one of the most segregated places to live in the country. And there's a lot of women here struggling not only while they're pregnant, but with their healthcare in many other ways. So what can you share with us about things that are going on right here in Boston and how we can continue to make health better for all women?
Yeah, that's an excellent question. I think there are efforts happening in lots of different places, but I was actually surprised to find that there hasn't been as big of a focus in Boston quite yet on maternal mortality as there has been in other states. For example, New York City has kind of been leading the way on this issue, and there's been a lot of activity too in Atlanta. So Boston is kind of still working its way there, but I was recently made aware of a new project that will be launching in the next couple of months, trying to address maternal mortality in Boston. And it's being led by folks over at the Harvard School of Public Health, and they're doing work to try to bring community members and advocacy groups together to specifically tackle maternal mortality in Boston. There have been efforts in the past, you may have heard of the REACH Coalition, which tried to focus on breast and cervical cancer, which are other areas that I work on. And there's also been a lot of advocacy happening at the city and state level. So just to give you one example, currently there's a big push around the country, including here in Massachusetts, to repeal the family cap policy, which is a policy that I looked at several years ago in research that I did with Diana Romero, who's down at CUNY. And basically, it's a policy, as you probably all know, that denies additional cash benefits to children who are born to parents enrolled in the cash assistance program. And so we found that this policy is not only ineffective, but it's punitive. And so there are advocates who are coming together, including the Mass Legal Reform Institute and others, to try to get that off the books. And there's similar efforts being led by other advocacy organizations. So if you're interested, I'd encourage you to definitely get out there and get involved, because there's a lot more to be done.
Madina, thank you so much for your presentation. I'm Chris Manjapra from the History Department and the Department for Studies in Race, Colonialism, and Diaspora. I wanted to connect what the tremendous work you're doing to, from my perspective, the larger transformation in the humanities and social sciences, which is, I would almost describe as changing the subject or expanding the subject. I mean, the way that you look at medicine and health provision through the lens, through the subjectivity of Black women and girls is really kind of transformative of the whole discipline of community health in general. And similarly, I feel that that's what so many of us in the humanities and social sciences are trying to do. We're trying to change the subject. So I just want to thank you for this powerful work and how it connects to so many other projects.
Thank you so much, Chris. And just to let you know a little bit about the process for developing this talk, I read outside of my field quite a bit, including through the introduction of folks who are in this room to a lot of humanities texts, including Christina Sharp and many others. So you probably see that. So that was a deliberate effort on my part to try to bring together the public health lens and also the rich scholarship that's happening in humanities, including in Black studies, that really helps us think through these issues in a way that is truly interdisciplinary, right? So bringing all of the different ways of thinking and connecting information in ways that ultimately will have a greater impact.
Hi, Madina. Thank you for this presentation and congratulations on the professorship. African Americans are obviously very diverse, and we are seeing more and more African immigrants and Caribbean immigrants come into the U.S. over the years. How is this work related to the ever-diversifying group of people who are Black?
Yes, excellent question. Thank you so much for bringing it up. It's something that I've been thinking a lot about myself as a Caribbean immigrant, and with other folks who are starting to get interested in this issue and raising questions about immigrant status and nativity and country of origin. From what I've looked at in the literature, these issues have yet to be addressed, and I think they need to be. So one additional kind of project that I added to my to-do list in preparing for this talk was to start looking at inequities among Black women by immigrant status, country of origin. Here in Boston, I'm especially interested in thinking about Haitian women as well, which brings in issues, right, like I said, immigrant status, also language in different ways. So I think that's really important. And in speaking with a student the other day, whose name I'm just blanking on, a student at Fletcher, if you're in the room, you can just raise your hand and remind you. Thank you. Yes, sorry, I'm blanking. We met on the phone, so it's good to see you. So we talked the other day about also integrating sexual orientation into this lens, right? So which is another dimension of social inequality that I focus on that has really been left out of the conversation of Black maternal mortality, as well as issues of gender identity. So I think there's a lot that we can do to kind of parse out the heterogeneity and really address the diversity and unique needs of various folks who are Black in the United States. So thank you for that. I appreciate it. Mm-hmm.
Hi, my name is Helen Marrow. I'm from the Department of Sociology. It's not a question, it's a thank you for being here. This work is so important, not only in public health, but in reaching out into the humanities. But there are obvious overlaps in our own field in the social sciences, and I appreciate your work for merging all of these disciplines, and I saw some sociologists up there already.
Absolutely,
So
yes.
an invitation to you to come talk to members of our department and how much impact you're going to have here. I already think that I see synergies here. We have a course called Sociology of Embodiment, how different structures and contexts get embodied and felt within the body that I think would be synergistic here. And I'd love for our department to learn from you and be able to work with you as you're here.
That'd be great. Thank you. We're done. I'm getting a signal that we're done. Don't be mad at me. Oh, maybe. Okay, one more.
Hi, my name is Marjorie Davies, and I worked at Tufts for many years, including originally at the Community Health Then program.
Wow.
So it's really great to see you.
Mm-hmm.
My question is about what kind of opposition you've encountered within academia, other academics, people in public health against the findings that seem to be so compelling? What kind of pushback do you get?
That's an interesting question. I haven't really gotten much pushback from people in public health. I think because the field is really focused on using a social determinants of health lens and thinks about the root causes. I think some of the bigger challenges that maybe I've encountered in presenting this and similar work has been in talking to folks who don't really think about social determinants. So folks who are really focused on healthcare delivery and think about that as kind of the solution to addressing health inequities. And so then the conversation becomes, how can you kind of situate healthcare in the context of community factors and institutional factors and state level policies. And I found that when in talking through it that way, that people are very genuinely interested in thinking about multiple levels, but may not necessarily feel like they have the capacity or ability to do that or to address that in their work. And so one thing that I've found very helpful is kind of working in interdisciplinary teams again. So I work with healthcare providers who kind of fill me in on the medical side of things that I'm not a clinician, so that I'm not as familiar with, and work with them to also start looking at, in their work, social determinants of health. So I found that to be helpful. In terms of racism, I mean, I think talking about racism always makes people uncomfortable. That's just a fact of living in a country with the history of the country that, we live in. But I just think it's an important thing to raise, so I haven't really kind of stopped doing that, so. Okay, I'm definitely getting the signal we're done. So thank you so much.